Okay, so we're going to talk about respiratory disorders in children and young adults. And I want to talk in this section just about how respiratory illnesses can be a little bit different in kids. Smaller children, especially infants and toddlers, are more prone to respiratory infections. Their immune systems are still immature in infancy. Their airways are smaller, so if they get a cold, that congestion impacts their breathing more. And they've had less exposure, and so they're building resistance in a sense over those first few years. But you really can have really frequent minor respiratory infections in infants and small children. The majority of infections in the respiratory system in children are viral and self-limited. That means they go away on their own. Now, self-limited does not mean that it cannot be a dangerous or deadly illness. It just means that the course of the illness is that if the host survives, it will go away on its own. Okay, so there are self-limited diseases that we still have to do some supportive care for to ensure or to make survival more likely, but self-limited means it'll go away on its own eventually. Respiratory illnesses tend to be seasonal, and that's been really, really interesting in the last few years because the COVID pandemic has changed the seasons for some of those. And we're going to talk about that in just a minute. But I want to finish the general typical information first. So the risk factors for respiratory infection, age, younger kids are more likely to get that infection, more likely to get sicker from it. Preterm birth, same thing. Chronic illnesses, especially if there's a respiratory illness. Cardiac anomalies that have any pulmonary congestion, so anything with a left to right shunt that causes heart failure. There's that fluid sitting in the lungs can be a place for bugs to grow. Exposure to pathogens, environmental smoke exposure, and this is one of the only modifiable risk factors. Smoke exposure increases the likelihood of respiratory infection because the respiratory system is inflamed. It tends to increase the severity of respiratory infection. So we want to teach and support families for smoking cessation and harm reduction. If they don't quit smoking completely, if they smoke less, they don't smoke in the car, they don't smoke in the house, that decreases the risk for them and their children. If they also wear some kind of outer garment when they're smoking that they remove to go back into the house, that further decreases that risk. We also want to work on prevention of tobacco use in children and adolescents. And we really had made a lot of progress in that. So in my parents' generation, that would be the baby boomers, smoking was still seen as pretty cool. There were really high rates of smoking. Gen X, that's my generation, that was starting to wane a little bit. There's still quite a few people my age who smoked because their parents did. They picked it up from their friends. But there was more of a move to let's stop smoking, stop smoking. So my children's generations, and I have kids who are millennials and Gen Z, and smoking had really become very uncool for millennials. And then vapes were introduced. And vaping has been marketed to children and teenagers and young adults as a safe alternative to smoking. And so initially it was targeted at people who smoked as a harm reduction option. But companies want to make money, and so they enlarged their market by advertising to people, including adolescents, who had not been previous smokers. And so now we have a whole other generation that a very large percentage of them are vaping and not really completely understanding the risk of that. So, and another risk factor for respiratory infection, going back to non-modifiable risk, is allergies. So what does a respiratory infection look like in infants and young children? Well, they may have fever, they may have poor feeding or poor appetite, they may have vomiting or diarrhea. They may have abdominal pain. We may see nasal discharge and swelling. Remember that infants are nose breathers, so a stuffed up nose or lots of nasal discharge can actually interfere with oxygenation. We've got to keep their noses clear. They may have a cough. Lower respiratory infections, we may hear adventitious breath sounds. We may they may have a sore throat. Meningismous is when the child has meningeal irritation symptoms, but they don't have an infection of the meninges. So meningitis is one of those things that terrifies parents because some types of meningitis are contagious and can act very, very quickly. Meningitis is inflammation of the meninges in the central nervous system. One of the symptoms of meningitis is meningismus. When their neck is stiff, it hurts, they can't bend their neck forward. So sometimes kids will have meningismus, especially little kids, with a respiratory infection that has not impacted the neurologic system. And so that can be a really scary symptom to see. We do still want parents of kids who have meningismus to get that evaluated. But sometimes it can happen with just respiratory infections. Now, I want to talk just a minute about how the COVID pandemic has changed some of this. So for a really long time, there were seasons. There's flu season around October through, February, March. Usually hits our part of the country around January, February. There was RSV season around November through early March. So we had these respiratory diseases that kind of happen at specific times. We also tend to see a lot of colds during the school year because kids are all in the same room. They have a cold. By the time they have symptoms, they've already passed it on to someone else. So about a cold a month is not unusual in the early school years because they're just beginning to be exposed to these things and develop some immunity. So we're going to talk about COVID itself later in this lecture, but I want to talk about how the pandemic has actually affected some of those other respiratory diseases. So one of the initial responses in COVID was to encourage people to stay home unless they had to be out for work. They had kids doing school virtually. They had a lot of families working from home or a lot of parents working from home. So there was a really decreased exposure. And then there was encouragement or mandates to wear masks, at least when indoors, for quite some time. Okay. And those mandates now tend to be relaxed when COVID numbers are low and put back in place when the numbers go back again in some places. So we're still seeing some masks and we're seeing the mandates kind of come and go now in relation to COVID numbers. But because our behaviors changed in response to COVID, that actually changed the way these other respiratory illnesses behave. So we saw a lot fewer colds during the last couple of years. We're beginning to see those come back because mask mandates have gone away in a lot of places. They've been made illegal in a lot of places. So there's a lot fewer people masking. So we're seeing more colds come back again. And flu and RSV seasons got shifted. We actually had 1 year that we didn't have a real flu season or RSV season, and then both of those things happened in the summer. And we're kind of looking now, we've had a very light RSV season. I actually haven't seen any RSV at all this year. So we're wondering if maybe that's going to shift to summer again. Flu season got a really late start where we live and in most of the country. And those shifts have been in response to public health measures aimed at decreasing transmission of COVID-19. Another way that that's affected this, though, is historically, We have worked through colds in the US, and we have had our children go to school if they had a cold without fever or serious symptoms. And that's been pretty much standard. And now, because COVID can begin with simple cold symptoms for a lot of people, now every time someone has symptoms that have been associated with COVID, there's a question. Is this just a cold, or am I going to go spread COVID to everyone I'm in contact with? So that's also changed how we look at or how we respond to those simple respiratory illnesses. In some cultures, it's common to wear a mask anytime anytime you have respiratory symptoms. And there are some people kind of pushing for that to become more of a norm here, that I've got a cold, I'm still going to go to work, I'm going to wear a mask so I don't spread it. So we might see more of that. We may not, because in some parts of the country, we've gotten a lot of backlash against those public health measures. So that's kind of how COVID has affected respiratory illness in children. In the next section, we're going to talk about general care measures for respiratory illnesses.